How many types of porcelain restoration are there? And can you tell me the pros and cons of each one?
There's actually a lot of types of porcelain materials available today that we use for veneers and mostly for crowns. Let me categorize them for you. We have the old generation porcelain, okay, which is called feldspathic porcelain. That's one of the best porcelains as far as the cosmetics involved. Unfortunately, they're not strong, however, they give you the best result. Then we have something else, we call it lucite porcelains. Lucite porcelains are the type of porcelains like Empress Crown. They are not only porcelain, but also plastic added to the material. As far as the strength, they are better than feldspathic porcelain. However, they're still not as strong. They look great and beautiful. The third type of porcelain that's been coming to the market, we call it lithium disilicate. It's called Emax crowns. Emax crowns are wonderful, but they're more translucent in nature. So for somebody who wants to go ahead and have a more natural look, I would recommend actually lucite or Emax or feldspathic because it gives you a natural color. Now, if the bite is a kind of traumatic bite that the patient has, meaning that they grind, clench, we have to go mostly to a more durable porcelain, which Emax is a more durable porcelain, and it's a very strong porcelain. There is the fourth type of porcelain. That's called zirconia. Zirconia or lava porcelain, they are extremely strong, okay? They work great, okay, on patients with heavy bite, and we call it grinding habit. It withstands a lot of bites of occlusion or the bite. They are unfortunately very bright and opaque. It will work for some patients who they want to have Hollywood white smile, but some other patients, they just want to have a natural white smile, so zirconia will not work for them. Zirconia is very strong, it's got its own indications and so forth. For you as a patient, okay, to come in and finding out, okay, what's best for you, we really need to do a full mouth evaluation on you. And then after I see the bite and I do my own bite analysis, we go ahead and tailor a treatment plan, okay, which best fits your bite. So sometimes there's a possibility that we might say, yes, you need an Emax crown, and then, which is strong, or a zirconia crown. But then I also have to see where you want your smile to be as far as the cosmetic goes. If you want the most gorgeous smile, still the feldspathic is the best kind of porcelain to use. It's the most involved veneer or crown procedure with feldspathic versus Emax or zirconia, which they are milled. This, I hope, answered your question. I have seen a lot of patients with feldspathic that they wanted to have a beautiful smile, but they fracture those. And then I also have seen a lot of people that they have zirconia, but they don't fracture it, however, they don't like the results. So it's the results, okay, is mostly subjective. You have to come in and we'll look at you and we'll guide you on the right direction.